So one of the most or more common things that I treat is something called carpal tunnel syndrome. I'm sure most people have heard of this, but basically they come in presenting with numbness and tingling in their hand, usually wakes them up at night, which is what really brings them to me is when you can't sleep, then it's a problem for you and your spouse. So they come in with numbness and tingling. We first work them up. Usually that requires getting a nerve test, which we can do here at OrthoArkansas. And then we go over the results, and basically the results kind of dictate what treatment we give to you as a patient. Mild carpal tunnel can be treated sometimes with just splinting and a steroid injection. If it's more severe, then usually we'd recommend surgery, which entails making a small incision in the palm or wrist and then releasing where the nerve is getting compressed. Usually recovery for that is relatively quick in the fact that it's just time for the incision to heal. Now that only takes a few weeks, but you do have to realize you will have some palm tenderness for at least 4 to 6 weeks. But overall, after 2 weeks, you can kind of start resuming your regular activities. One of the more common things we treat as a hand surgeon is something called trigger finger. Now I know it's crazy because people always say, well, this is my trigger finger. Well, that is true, but it can actually affect any finger, including your thumb. Basically what happens is the tendon gets stuck in the little tendon sheath that it runs in, and your fingers will get stuck in a flexed position, which, as you can imagine, is fairly problematic, and it causes significant pain. Treatment options for that usually range from trying a steroid injection, which we usually try first, and it has about a 50% cure rate. If it does not resolve after 1 steroid injection, we will try an additional steroid injection in 4 weeks. If that still doesn't work, then we fix it, which is usually pretty easy to do. Small incision is made in the palm at the base of whichever finger is triggering, or thumb, and then we simply release a little pulley or ligament that is causing the tendon to get stuck, which then resolves the triggering. Recovery for that is usually just time for the incision to heal, so 10 to 14 days, and then you pretty much can resume regular activities. One of the more common things we treat in hand surgery is also something called the Quervain syndrome. I don't know where they got the name, some French guy I think, but regardless, it's where basically patients have pain right here on the radial side of the wrist or thumb side of the wrist. They also call this new mom's thumb, but obviously you don't have to be a new mom to get this. I think that texting also causes people to get this problem, especially in the quarantine days. People are texting more and doing more social media, so we've kind of had an increase in the Quervains. So treatment for the Quervains, basically there's 2 treatment options. The first treatment option is to try a steroid injection, which is about 50% effective. So usually we try a steroid injection first. If that does not work, we can try a repeat injection at 4 weeks. If you still have pain, which can be fairly debilitating, we will perform surgery, which is basically a de Quervain's release, which entails making a small incision at about 1 inch long and basically releasing the tendon sheath that the tendons run in. And that usually does fix the problem. Recovery for that is pretty quick, usually 2-week recovery. Once the incision heals, which like I said, 10 to 14 days, then you can pretty much resume regular activities.